my name is Vanessa and I'm presenting on carpal tunnel syndrome today. So carpal tunnel syndrome is a medical condition involving a squeezing like or compression of the median nerve in the carpal tunnel on the palm side of the hand. That's also known as the volar aspect. Okay, this can happen to one or both hands, and genetics are definitely a factor when it comes to carpal tunnel syndrome, also known as CTS. Okay, women are more prone to have CTS symptoms and complications. Other causes of CTS can be repetitive movements, sports, injury, things like fractures, RA, dislocation of the wrist. This can all cause these compression to the median nerve, giving the symptoms. Symptoms of CTS include reports of electric shock feeling, sensations of pain that run through the digits, as well as burning, tingling, numbness, sensations. This can also travel up the extremity all the way up to the shoulder as well, okay? People can also have decreased strength, so decreased grip and pinch strength of the hand affected. This will also compromise their success and affect their ADLs and IADLs. Increased symptoms are also reported at night due to poor positioning. So if you're one to kind of sleep with your wrist in extension or inflection for prolonged amounts of time, that can also increase pain during the night. That's why splinting is always used in the more severe cases with more pain reported at night. Okay, so some of the treatments that can be used for CTS include occupational therapy. Within therapy, you can work on pain management, range of motion, increasing strength and dexterity, also teaching techniques for proper positioning, joint protection, things like that. They will also benefit from nerve glides, tendon glides to relieve those symptoms of pain, also help increase range of motion. Medically, you can have cortisone shots, anti-inflammatory medications. I mentioned splinting before, and then also carpal tunnel release surgery if symptoms do not minimize or decrease. Okay, the surgery does not guarantee any symptoms to go away completely. There's always a risk that it can come back. Okay, so surgery is not guaranteed. That's why they try to do therapy first. So prevention will be just good positioning, good ergonomics at your workstation, exercise and rest breaks if you're in those jobs of increased exposure to like prolonged writing or use of keyboards. Okay, so we're gonna get into some of the anatomy of the hand. So I have two hands here, and we're going to go ahead and illustrate some of the components of the wrist and hand so that you can get a better understanding of what is all involved. Okay, so this is the carpal tunnel. This is the transverse carpal ligament. Excuse my handwriting, guys. All right. Here is going to be the tendon sheath. And then you're going to have the tendons that pass through the carpal tunnel. And this transverse ligament that I drew here, that is what is encasing or making rather the carpal tunnel. That ligament there is going to in-house the 9 tendons as well as the median nerve that innervates most of the hand. So the median nerve is also in that carpal tunnel, and it's going to innervate that ring finger, middle finger, index, and thumb. Okay, so within that carpal tunnel there, now we have 9 tendons and the median nerve. that pass through that carpal tunnel, okay? And then we'll label this here in red. That is the median nerve. Okay. Now, on this side of the hand, we're going to just illustrate just where that median nerve is going to supply. So just that portion there, small portion of that ring finger, middle, index, and thumb, okay? And that is supplied by the median nerve. Okay, so what is carpal tunnel? This tunnel here that houses those 9 tendons and the median nerve get really inflamed from that repetitive movement and cause pressure there at some point. It makes contact with the median nerve, and that's where they get those sensations through the hand of any pain, tingling, numbness, anything like that, okay? So that's what we're trying to minimize, is the risk of inflammation within that carpal tunnel. So here you're going to see basically a cross section of the wrist. If we were to cut the wrist, we're gonna say that these are carpal bones, okay? These are carpal bones here in black, okay? We're going to have a median nerve, median nerve is there. If this is the carpal tunnel running through that cross section of the wrist with 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, we're going to just illustrate this a little bit better. Okay, now if this is a normal wrist or typical, and this is CTS affected, that median nerve is pushing right up against that carpal tunnel and it's inflamed, okay? So this is someone with a positive CTS, this is someone with negative CTS here, okay? That transverse carpal ligament that we drew up here that kind of encases all of that, that would be on the top part, that volar aspect of the hand, okay? That's that transverse ligament kind of just encasing them in there, okay? And then you have, like I said, the cross section just shows where that median nerve is being compressed, and that's a positive CTS, okay? So let's recap a little bit. We have 9 tendons. We have 1 median nerve. We have the transverse carpal ligament that encased them all. It's like sausage casing, if you would. And then these are just running through that sausage casing, okay? So within those 9 tendons, we have the FDPs, we have the FDSs, and we have the FDL tendons. So you get 4 FDPs, 4 FDS, and 1 FDL, okay? And then that comprises 10 running through there, okay? So think of it as a house built on rocks. The rocks are your carpal bones. In the house live 10 people. Okay, the biggest one of all is gonna be the median nerve, and then the other 9 family members in the house are your tendons, okay? Thank you for listening, guys.